Through the miracle of biology, our bodies carry many defense systems meant to keep us alive. But on the way to doing that, they'll sure make us feel sick.
The infection itself triggers inflammatory cascades, and your immune system starting to fight it causes things like fevers and things like that.
Dr. Dan Bizzle is an emergency room doc and the director of emergency services for Legacy Salmon Creek in the Vancouver area. He'll be our expert today. First, how can you tell if you have a cold?
It's certainly true that, a common cold is still a common cold. And if you just have some head congestion, no fevers, no body aches, there's a reasonable chance you might just have a cold.
But when we move on to the more serious flu or COVID, things do get a bit more tricky. Here's a list of symptoms on the left from the CDC. All the flu symptoms are common to COVID as well. They include fever or chills, cough, sore throat, fatigue, muscle or body aches, headache, runny nose, vomiting, diarrhea. What separates COVID? The addition of the loss of taste or smell and the addition of shortness of breath. Although, just to keep things really confusing, you can have some but not all those symptoms and still have COVID.
Very difficult to differentiate that from COVID. I'll be honest with you, in the emergency rooms, we have a hard time just on the symptoms or clinical grounds alone distinguishing.
Dr. Bizzle said some things to think about include, where were you recently? Who were you around? And how likely is it that any of those folks were infected? Are you vaccinated? Also, think about what happens if you do have COVID. Will you be exposing lots of others if you don't quarantine yourself? The best solution is to get a COVID test. Often your doctor's office can order one. They're quick and, yes, safe.
I've had a few questions from patients who were concerned about the safety of the test. Can you catch anything from the test? And the answer is absolutely not. The test is completely safe to get. It is literally nothing more than a Q-tip that's trying to take a sample of the mucus that's at the very, very back of your nose, top of your throat area. But there's nothing on the Q-tip. It's completely safe to get tested.
So that's good to know. By the way, if you have been going through this or you know someone who has, I can totally relate. I had a couple days last week where I felt particularly crappy, so I ended up getting my first COVID test towards the end of the week. Happy to say it's negative, and it was quick and easy. By the way, Dr. Bizzle says that you can get your flu shot at the same time you get your COVID test, whether it's a COVID shot, rather. So flu shot and COVID shot, even if it's the booster, you can get them at the same time.